Oh, there we go. Okay. Salam, everybody. I'm Asia, and then Anisah is here with me too. We're third-year medical students at Central Michigan College of Medicine. And so we did this project on career satisfaction in Muslim female physicians. So kind of the biggest thing that pulled us towards this is, as women working towards becoming female physicians, we wanted to kind of see if there were different factors that went into, you know, the Muslim space versus differences between just regular female physicians, because there is quite a bit of literature out there on female physician satisfaction. And we wanted to see if there was any specific criteria that was exclusive to Muslim women. Mental health is a growing concern, and physicians have a really high suicide rate that hasn't gone down just yet. So we wanted to see if we could get more insight into that. So what we did is send out a survey through different social media apps, so WhatsApp groups, Instagram, Facebook, just any kind of social media platform you can think of, to recruit as many people as we could. And the questions that we used, focused on a few different factors. So we looked at career satisfaction criteria, things that women would look at as dissatisfying, if they had regret, and how things like having children, facing discrimination, and having autonomy in the workplace factored into their satisfaction rates. So we had 49 respondents, with 38 answering over 78% of the survey. So even with our small sample size, we did have a nice variability in all the criteria. So if you look at stage of medical training, so a big chunk of our participants were either post-residency or in residency, and then we had a couple of people doing their fellowship and people who had just finished post-fellowship. And then if you look at specialty, a little bit more than 50% of our participants were either in internal medicine, family medicine, or OB. So a lot of primary care, and then OB, and then we had quite a bit of disparity with a few people in each other category as well. And then so for age of participants, a big chunk of our respondents happen to be millennials, so kind of in that 23-ish to 40-year age range. But we do have a little bit of, you know, people above 40 as well, and then a few people in their early 20s. And then ethnicity happened to be majority South Asian women, but we did have Middle Eastern, and then people who classified as other as well. So Anisah will talk about the results.
So for our results, first of all, we were hesitant to come to really any major conclusions, given that we only really had 38 survey responses to work with. But overall career satisfaction, when we did the univariate bivariate analysis, we found that career satisfaction was most associated with intrinsic interest in the work they're doing, support they receive at work, patients that they're working with, and work-life balance, which sounds kind of intuitive, and it was in line with other research that was focusing on career satisfaction as well. Interestingly, we did see that 17 out of the 38 surveyed said they would change their specialties. And there wasn't really clear statistical significance correlating that to any other factors, but 85% of the people surveyed would keep their current career, while 15 said they would have chosen an entirely different career. So 15% of 38 isn't that much, but even then, you know, we had like 5 women that were saying that they would have preferred to not have been a physician. And then with those few, they were found to be more religious, had more bad mental health days, and were overall less satisfied with their careers, which I mean, the second two sound intuitive, but you know, the religiosity, we weren't really sure what to conclude with that. And then again, just because our sample size is so small, we can't really say with any sort of certainty that this group of people have like these similar traits. Okay, next slide. So the key factors, we did have a section of the survey that was a free text response just to see what people were saying. And some common themes in the satisfaction factors were, again, work-life balance, and the patients that they're working with. Collegiality at work, both with the doctors and administration, was pretty important. And then intrinsic interest in the work that they were doing, where we had people saying that they were very satisfied and felt like a sense of fulfillment through the work that they were doing. The satisfaction factors were, the main one was work-life balance, poor quality of management, leadership, not living near their family and friends, which we thought was interesting, and then lack of work autonomy or control over their hours. And then the last part that we want to talk about was children versus no children. So I know that we had some interest in this discussion. 19 participants said that they did have children, and mothers were equally satisfied with their career compared to non-mothers, which we are happy to hear. Of the 19 with children, 15 indicated that motherhood had made them somewhat or better physicians. So it didn't really seem like there was any sort of many people saying that being a mother somehow made them less of a better physician. 15 indicated that being a physician made them somewhat or a better mother. So it kind of went both ways. And then mothers reported spending more time caring for their children than, and that was found to be associated with more bad mental health days.
So,
I know you're almost done, but we're a little out of time. So
no, that's okay.
Thank you so much, Anisah and Asya, for sharing your presentation with us. If anyone has any questions and would like to, I'm sure you guys can contact them directly on the HOVA app and discuss their presentation further. We are going to move on to our next presenter, Mr. Hamidi Rahman. He's from the University of Kebangsaan in Malaysia, and he will be presenting on the scale for positive identification of Jinn possession. The belief in Jinn possession is, and he will continue with that. If he can, nope, got it.
Yeah, good to go, Mr.
Hamidi Abdul Rahman, you may begin.
Hello, can you hear me?
Yes, we can hear you.
Yeah, okay then. Can you see my screen?
Yes, we can see your
Okay
screen.
then. Okay, good. Okay, it's I think 5 minutes is very short time for to discuss everything.
Yeah.
Okay. So I'm going to go very quickly. Okay, the skill for positive identification of Jinn possession. This is based on many research. Okay, so first of all, when we talk about Jinn possession, we must know that it's based on the Islamic epistemology. That is, the source of knowledge must not only just come from the Aqli, which is logic and science, but also from Naqli, which is evidences through divine revelations, okay, from the Quran, from the Hadith, and so on. So the presence of Jinn in Islam is confirmed, and also Jinn possession is also something which is a reality in Islam. Okay, so we have done a analysis of this on 198 samples of people, with 530 of them has got Jinn possession and 588 is not Jinn possession. So we look at the symptoms of the people who has got Jinn possession, and from that we did analysis. Okay, I did analysis on the using principal component analysis to find out which are actually the dominant or the significant symptoms of Jinn possession. In normal cases, okay, normally people will identify Jinn possession or diagnose Jinn possession through a method called ruqyah. Ruqyah is a recitation of Quran or anything which does not contradict the Islamic Sharia. And when ruqyah is read on somebody who has got Jinn possession, then there will be a an adverse reaction like screaming, vomiting, feeling hot, whatsoever. Okay, so we identified out of the 188 samples, 530 of them got jinn possession, and we analyzed the symptoms. And from there, 23 symptoms, okay, were identified as significant. Okay, and if you look at the symptoms of jinn possession, some of them are also symptoms of mental disorders. So there's an overlapping between symptoms of jinn possession and symptoms of mental disorder. It is why there are sometimes conflicting diagnoses. People who have got these overlapping symptoms, well, psychiatrists say that it's mental disorder, but those who deal in jinn possession, they say that they have got jinn possession. Okay. So if there is jinn possession, obviously it will create problem to the mind, and obviously you will have mental disorder. You have some symptom of mental disorder as well. So anybody with jinn possession, normally they will have some form of mental health problems, right? So okay, so while by analyzing the 23 significant symptoms, okay, and each symptom has got a loading, means the significance of the symptoms, and the score is calculated by having summing the symptoms of the person. Okay, if the person's got, let's say, paranoid, you got put some 0.684, and for another symptom from Islam, you got put something. So you can sum the loading, and by summing the loading, you get a score. Okay. From that score, okay, there's analysis to find out, okay, what score above which you can say for definite that the person has got jinn possession. So another analysis was being done, okay, using the ROC analysis, receiver operating characteristic analysis, to determine the cutoff value above which, if the score is above that number, then you can confidently say that he or she has got jinn possession.
Thank you.
Okay,
thank you so much for your presentation.
Sorry?
Thank you so much for your presentation. I'm sorry to interject.
So we had from there we had the scale, which is above 1.9 is positive, between 1.8 and 1.9 is borderline, and below 1.2 is negative. So it's I've got to trust. Okay, thank you.
Thank you. Thank you so much.
So next presentation, we have Qawwam and family leader, well-being in facing UVA world, Al-Ghazali, Chaliphal qualification measurement model. And the presenter is Ahmad Aizuddin Rami and Siti Aishah Hassan. Do we have them with her here? Okay, I think we don't have it. And after that, it's the same presenters, Siti Aishah Hassan and Mohammad Asraffuddien Basri, for Fragilities Unmasked via continuous use computers. Do we have them? Any of them here?
I would just request, if you're a speaker for the poster presentation, if you could please put your first and last complete name so that we can more easily identify you.
So the next presentation is by Neda Delami and Siti Aisha. The topic is Al-Balkhi Cognitive Behavioral Therapy for Unmasking Fragilities and Social Isolation. I can see, I think we have Neda Delami with us. Can you please unmute yourself and start sharing the screen?
Okay, hello?
Yes, hello, we can hear you.
I can hear you.
Okay, actually I sent a video for my presentation, and I don't know if the presentation is ready to show or not by the host.
Okay, we will.
Because before that, I sent a 4 minutes video with conference team.
Yes, we will actually.
We will have to check because we did have some videos, but we didn't have your video yet. So we'll check, and then as soon as we find it, we're gonna play it.
Yeah, I have 2 presentations, and both of them, before that, I sent 2 videos.
Okay, we will get on top of that, and we'll move to the next presentation in the meantime, and then we'll come around to that. Thank you.
Okay.
So our next presenter is recorded video, so we will share that.
You can share our screen. Can you all see our screen?
Assalamualaikum warahmatullahi wabarakatuh. Muhammad Hamdan bin Muhammad Nordin and team members, Professor Dr. Siti Aishah Hassan, Professor Dr. Ismail, and also Associate Professor Dr. Halimatu Sa'adiyah Hamdan. My title is Unmasked Fragilities with Al-Ghazali's Maqasid Al-shariah framework, Dyadic discernment skill among youth in marital conflict. Unprecedented challenges of COVID-19 have increased for psychological help due to fragilities of social isolation. Divorce is highest among Muslims, especially youth in Malaysia. The objective of this study is to develop and validate dyadic discernment skill among youth in marital conflict. This study involves two phases. First phase is development phase, and second phase is validation phase. Conceptual framework. The contributing factor for divorce will analyze based on Maqasid Al-shariah, Daruriyat, Hajiyat, and Tahsiniyat. The result, dyadic discernment skill used for assessment in counseling. The finding of this study is, first, dyadic discernment can be defined as a wise decision-making process, the outcome of which is determined by the couple who are in marital conflict on whether to choose, maintain status quo, reconcile and improve their marital interaction, and increase marital satisfaction, or 3, divorce and work on individual well-being and custodial arrangement. Second, DDS, Dyadic discernment skill, is meant to help youth in conflict to distinguish between harmful and beneficial decision-making, construct of wise decision based on Maqasid Al-shariah. First, hierarchy needs of the DHD. Second, beneficent versus maleficent, and 3, specific beneficent versus general beneficence. Conclusion of this study is Dyadic discernment skill is a reliable and valid instrument that helps clients make wise and informed decisions on their marital relationship. Implication of this study is result dyadic discernment can be used in assessment intake for counseling and case management standard operation process in district religious department and Sharia courts in Malaysia. Thus, have to unmask fragilities among youth with marital conflicts. Thank you for my presentation, and Assalamualaikum.
Thank you very much.
So next video is next presentation in line is also a video. We are trying to find it. And then the next one, we have perinatal health outcomes in Muslim women during COVID-19 pandemic by Taqwa Tufaha and Venus Mahmoodi. Do we have these presenters with us here? No? Okay.
Okay.
So I think meanwhile we are figuring out this video issue. We will wait for our discussant. And if anybody has any question regarding the presentation already presented, the floor is open for you guys.
Or if any presenters have questions for their fellow presenters, that would also be, so this also be a good time.
In the last presentation, in the conclusion of the 3 factors that were like salient and could be used clinically, I wasn't clear what the 3 factors are.
That's a good question. The video presentation?
Yeah.
Actually, the presenters with us, Mohammad Hamdan. Mohammad Hamdan, we have a person who has a question for your presentation, the recorded presentation. She wants to know what she wasn't clear on the 3 factors, or you can repeat your question again.
Yeah, in the very end of the poster, at the end of the presentation presenting the conclusions of the study, it referred to, you know, like that there was a good Cronbach's alpha for 3 factors, but I wasn't clear what those 3 factors are.
That's a good question. Let me see if the speaker.
Sorry, may I ask a question about the other?
Oh, yes.
Not exactly about the presentation. I wanted to know, did you find my video presentation or not? If you cannot find, okay, never mind. I can present now.
Oh, okay, that would be great. So let's see if we can answer that question. The speaker, Mohammad Hamdan, you are here. You just had a recorded video presentation and we had a question for you. Would you be able to answer that right now? Can you hear us?
Yes, I'm here. What question? Can repeat, please?
Yes, Masuma, I'm sorry, can you repeat it for again for him?
Yeah, just the end of the poster, when you talked about that your conclusions, that there were 3 factors that would be salient to use clinically with young couples who are in discernment counseling. But I wasn't clear what the 3 factors are that you were referring back to.
So she's asking what the 3 factors are that you're referring to towards the end of your presentation. The 3 factors, most of the 3 factors for
Yeah, there was something about the Cronbach's alpha for 3, like there were 3 significant findings, but I wasn't sure what they weren't named in that space, and I'm assuming they referred back to something. I'm just wondering what they were referring back to.
The question I'm not clear.
Go ahead.
It's okay if it's just not a clear question. I know that the time is very short here and there's lots of presenters.
Or you know what, you can actually send your question to him in the chat and then he can probably answer your question and you know, one-on-one or later on. How about that, Masuma? You can send him the question in the chat directly.
Okay, I think better the question chat first, and then I try to answer. Okay.
Okay, thank you very much.
Let me say something. So, Miss Nida Dilami, sorry for the video confusion. So can you please email your presentations again for us to play?
No, she can do it right now.
Right now? Okay, perfect. Perfect.
So,
If you want, I can I try.
yeah, you can present now. That would be great.
Yeah. Okay. So.
Okay, that would be great. Thank you.
Should I start?
You can go ahead and share your screen.
Okay. Yes. Let me just. Okay. Wait a moment, please. Okay. Okay. Can you see the screen or not?
You have to share your screen.
Yeah, I share.
Can you go to your presentation so we can check if your screen is sharing or not? No, we are unable to see your screen. It's just.
I do my best to share.
It's fine. Just try it once more, and if that's not possible, maybe you can just email us the presentation and we can play it for you.
Okay. Okay. How what? No?
Now we can see.
Yes.
Yeah.
Okay. Actually, this is Neda Delamir. Hello?
Yes, you can.
Can you see me?
Yes, we can.
Oh, okay. Okay. This is Neda Delamir, research assistant of UPM, and it's my great pleasure to talk about the result of one study that was done under supervision of Professor Dr. Siti Aishah Hassan with the title of Al-Balkhi Cognitive Cognitive Behavior Therapy for Unmasking Fragilities and Social Isolation, Randomized Control Trials and Depression and Sexual Satisfaction among Menopausal Women. Okay. The main concept of this study was sexual satisfaction and depression. That was concluded, that was supposed to evaluate among 72 menopausal women. We have the aim for decreasing depression and increasing sexual satisfaction to prevent fragile feelings and also social isolation, particularly in the uncertain situation of COVID-19 pandemic. Actually, there are many well-known and appropriate documents about that show the effect of CBT, cognitive behavioral therapy, on decreasing of depression. However, there are some inconsistencies in the literature. For example, as our gaps in a study, we found the mention, the main mention of gap for this research is the very little study about the effect of Al-Balkhi cognitive behavioral therapy on the menopausal women in the literature, and also no culturally adapted of CBT version in terms of cultural and religious values among menopausal women. And also, the main assumption is the effect of CBT, and particularly Al-Balkhi CBT, has not done in this situation. Therefore, to find the best answer for these gaps, we try to do this study. Our objective was we want to conduct al-Balkhi cognitive behavior therapy for menopausal women for these two hypotheses. The first hypothesis, we postulated there is a significant reduction in depression and also increasing of sexual satisfaction among our participants in treatment groups across the time. And also, we want to know, in comparison with control group, the treatment group remain significantly effect for the decreasing depression and increasing sexual satisfaction.
I'm on a conference, so I'm just going to sit out here a while. What time do we actually start? Okay, that's what I thought.
I'm sorry, can you, can everyone mute, please?
Oh yeah, I spent a lot of time up
Okay,
here.
go ahead. Ms. Delamy, you can go ahead. Nada Delamy, can you please unmute yourself? Nada.
Okay. For the find of the best answer for these gaps and problems, and based on the literature and also our objective, we try to recruitment of 72 women, Iranian women, as menopausal women, and we divided them in these three groups. The treatment groups were under 16 sessions, and every sessions have 2 hour sessions, all treatment based on the Al-Balkhi and adapted culturally and religious. Okay. As the result, the findings have the findings shows us the results between groups in both individual and group al-Balkhi CBT have dedicated the mean scores of depression and also increasing significantly sexual satisfaction between time 1, time 2, and time 3. And the result between groups have shown that al-Balkhi CBT in treatment groups were efficiently and the effect maintained until the 6 months after the intervention. So based on these findings, we can suggest with the all clinical professionals that and also the psychology and also gynecology, they have to consider holistic approach of bio, psycho, and social controlly view for the treatment of menopausal women, that the depression is very common in this duration.
Thank you so much, Nada Delamy. I'm sorry. Thank you very much.
Okay.
Yes. So do you happen to have the other presentation with you, your other one? Yeah.
For me?
You had 2 presentations? Or you were part of 2 presentations?
Yes. Yeah, I had another presentation, and let me to share.
Yeah, so if you'd like to start your second presentation, that would be great. And then
Yeah, I can.
okay.
Let me.
Thank you.
Okay. And now the new screen. No, is the another
If it'll take you another minute, or so, then
yeah, but sorry to
no worries. If it'll take another minute or so, then we can.
We can just ask again. We can just ask for the presenters who were absent before if they are here, so they can do their presentation. Do we have Ahmad Aizuddin Rami with us, or Siti Aishah Hassan, Mohammad Asraffuddien Basri,
okay.
Taqwa Tuhafa, or Venus Mahmoodi? If any one of you guys are here, you didn't present your presentation.
If it's possible, I can share you, and I found the PowerPoint, the second PowerPoint. Is it possible I share it, or
Yes, yes.
I have to wait?
No, go ahead. The other speakers or presenters are
share?
not here. Yes, please go ahead and share your screen.
Can I share?
Yes.
Oh,
yes, you
sorry.
can share your screen.
Okay. Bismillahirrahmanirrahim. Okay. Can you my screen?
Yes, you can if you just go into presenter mode.
Okay. I don't know what's the problem. So maybe I have to wait again after another presenter. Sorry.
Okay, well, we don't have any other presenters at the moment. However, we do have a discussant with us, so.
So, Ms. Dilami, we will try to take on your screen control so we can start the presentation. There must be a pop-up on your screen saying you have to click yes on that. We're gonna request remote control for your screen.
I do.
Did you see a pop-up coming up asking for a screen control request? You just have to click on that, a yes on that.
Yeah.
Yeah, you can control it.
Okay. So.
You didn't find my presentation, the video presentation, yes?
No, sorry, we didn't. We do have other presentation in the YouTube video, the one we played, but all of the videos are in the same place. So, but we couldn't find yours. Sorry about that.
No, it's okay. But I found the PowerPoint, but I don't know why I cannot share that one. Maybe. Because did you see the PowerPoint?
No.
Do you see?
You're on your Zoom.
Yeah.
We cannot see the presentation.
We
but
can see a presentation.
We can see your screen, but it's on
A leader
the
in
Zoom.
2021. It's something else.
And the speed of internet, so sorry, it's very slow.
No worries, we
And
understand.
okay, can you see?
No,
Not yet. No, not yet. And our
Whose screen is it now? What I see on my screen is a leader in 2021 Gartner Magic Quadrant for meeting solution. This is what I see on my screen.
Yeah.
yes,
This is Miss.
The title is Dyadic Effect of Conflict Management. Did you see this?
So Miss Nida Dalami, if you can stop playing your screen, and then we have Miss Siti Aishah with us, so she can play her presentation. She wasn't here before, so she does have two presentations.
Which one that you want me to present?
Yeah, you have two presentation, and both of them weren't present. I think the third one with Ahmad Azimuddin Rami, that one if you can present. Let me double check the name for you.
Oh really? I cannot hear.
Okay, so can you present the presentation Qawwam Man Family Leader Wellbeing in Facing VUCA World Al-Ghazali Chaliphal Qualification Measurement Model?
Oh, that is Dr. Aizuddin. Dr. Aizuddin, is your turn.
Yeah, Ahmad Aizuddin Rami. Yeah, the one with Ahmad Aizuddin Rami.
Yeah, I'm here. Assalamualaikum.
Oh,
Miss Nida Delami.
Can someone stop sharing their screen?
Yes, Miss Nida Delami, can you please stop screen sharing?
Because all right, good. Yeah, better. Yeah, Dr. Aizuddin, you can share your screen.
Right here. Okay, we just made you co-host, so you can share your screen now. Dr. Aizuddin, you can screen share for your presentation.
And you are mute, you have to unmute yourself.
Wait,
We cannot see your screen. Yeah, we can see your screen now. You can start presenting. Thank you.
Okay, can you see my screen?
Good.
All right, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Very good evening, from Malaysia. And now our time is 8:30 p.m. So our topic is regarding to Qawwam Family Leader Wellbeing in Facing VUCA World, Qualification of a Measurement Model. So basically, our research is looking at how family leadership act during the VUCA world based the post-COVID-19 pandemic. So basically, from Ministry of Family and Women, we have a lot of issue regarding to family well-being, especially after post-COVID-19 situation. So from cases reported, we have 4,000 physical mental abuse, financial problem, and third-party harassment. So basically, we try to propose for Qawwam family leadership measurement model that is we implement by adaptation from Al-Ghazali. So basically the Al-Ghazali have implement two major themes. There is from physical and also the moral. There is the whole sanitary, liberty, medial sex, Quran and sound sight. So basically from the moral, we have a najdah, kifayah, wara, and so based on the Al-Ghazali, we try to propose a new theoretical framework on leadership measurement. Right. So to achieve our model, we try to use deductive content analysis with critical analytical thinking and also some team discussion. Whereas if you can see on my screens, we have 10 steps how we develop instrument of a Qawwam man family leader well-being process using a rush measurement model analysis. That is, the first step is instrument conceptualization, instrument development, phase and content validation, pilot tests for instrument testing, reliability test, item analysis, revise the instrument, and the field test of construct validation, experience validation, and last we try to compile all the manual application in research and practice. We hope that when we try to propose this empowerment leadership for well-being, this can be used for family, Muslim family well-being in Malaysia and also around across the world. So basically, we reflect to our current situation, especially in VUCA world. So this is time, a right time to propose a new theoretical framework, especially in area of Qawwam family leadership. Right. So that's all from us. So this is.
Thank you very much. I'm not sure if you completed or screen froze. Okay, well, thank you everyone for the presenters for presenting, and those of you who just listened in. That's really great of you to be working with us here today. And we actually have our discussant, Dr. Farah Basri, with us. Dr. Farah Basri, are you still here?
All right. Thank you so much from us. Thank you for listening. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Thank you. Okay, well, actually, Dr. Farah Basri is not with us at the moment. So we have a few minutes. We have like about 4 more minutes if anyone has any questions. There was one question I remember earlier by Masuma for Muhammad Hamdan, his presentation. I hope she was able to directly message him and get her question answered. If not, please or message us and we will have your question written down and can get back to you.
And in case any, just for all of us, for all of you guys, a reminder, in case anybody missed any presentation, all of these sessions, all of the conference will be available on our YouTube channel soon after the conference end. So you can always go and watch from there. Thank you. So we don't have Dr. Angu presentation listed in our list. I think she must be on other track. We do have ongoing track A, C, and D. We checked in our list. There was her topic was not in the list for track B.
Okay, let me check. We'll add a track first.
Thank you. All right, everyone, thank you so much for joining us for this session of the online poster presentations. Tomorrow,